Today, we're diving into a fascinating study on canine elbow health. Osteoarthritis is the most common orthopedic condition in dogs, with a significant negative impact on their welfare and quality of life, commonly affecting joints like the hip, stifle, elbow, and shoulder. In the canine elbow, osteoarthritis often develops as a secondary condition to elbow dysplasia, a group of inherited developmental abnormalities. Notably, Labrador retrievers face a nearly 6 times increased likelihood of elbow dysplasia and associated osteoarthritis compared to crossbred dogs. While subchondral bone cysts are a recognized imaging hallmark of osteoarthritis in humans, horses, and mice, their presence in dogs has been only sporadically reported and not well established.
That's right, and conventionally, diagnosing elbow osteoarthritis in clinical practice relies on clinical examination and diagnostic imaging, primarily radiographic examination. However, computed tomography is becoming increasingly commonplace due to its enhanced specificity and sensitivity compared to traditional radiography. This is particularly useful because subchondral bone cysts are not easily identified on plain radiographs of the canine elbow, likely due to their small size and the superimposition of the elbow's component bones. This study aimed to investigate if subchondral bone cysts are present in canine elbow osteoarthritis using computed tomography, focusing on Labrador retrievers, and to understand their relationship with the severity of radiographic osteoarthritis.
And the results are quite telling. The study found that subchondral bone cysts were only identified in elbows that showed osteophytic new bone formation, which is a definitive sign of osteoarthritis. Crucially, no subchondral bone cysts were observed in elbows without any radiographic evidence of osteoarthritis. The research also established a significant association between both the number of subchondral bone cysts and their maximum diameter with the severity of radiographic osteoarthritis. Specifically, the rate at which subchondral bone cysts were present increased significantly for both moderate and severe osteoarthritis compared to mild osteoarthritis. For dogs with severe osteoarthritis, there was an increased likelihood that their subchondral bone cysts were larger than those found in dogs with mild osteoarthritis. While age was not associated with the number of subchondral bone cysts, both age and sex were associated with their size, with older and male dogs more likely to have larger cysts. Most of these cysts were located in the humerus, with the remainder in the ulna and radius, and they predominantly formed in the medial compartment of the elbow.
These findings are quite significant, as this study marks the first time the relationship between an increasing number of subchondral bone cysts and radiographic osteoarthritis severity has been reported in canine osteoarthritis. The complete absence of these cysts in normal elbows further supports that they are a characteristic feature of canine osteoarthritis,